Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. Growing challenges facing nonprofit LTC providers include crumbling Medicaid rates, rising compliance demands, and ongoing staffing shortages. Choices often seem bleak. Sell to a for-profit chain or shut the doors entirely. One New York provider chose a third path. Wartburg, a 34-acre campus, decided to integrate into ArchCare. Wartburg had already downsized nursing home operations, finding it increasingly difficult to remain independent. The partnership was made possible since ArchCare is one of few nonprofits left with the financial strength to absorb another organization. Wartburg's board chose to preserve its nonprofit mission, trusting ArchCare's track record of honoring faith-based traditions and supporting staff during previous integrations. For ArchCare, Wartburg brings major strategic advantages: access to more affordable and independent housing, assisted living, memory care, and a stronger foothold in the private pay market critical as Medicaid funding continues to fall short. Integration gives Wartburg residents access to ArchCare's stronger clinical infrastructure, including a system-wide chief medical officer, roaming regional nurses, and centralized resources like HR, purchasing, and capital planning, creating smoother transitions for seniors as they move across levels of care. From independent living to rehab, LTC, PACE, or hospice, while keeping their history and needs in one connected system. A new study out of Brown University is raising serious questions about Medicare's decades-old 3-day rule to prevent unnecessary nursing home spending. Researchers say in today's healthcare system, the rule's doing the opposite, driving up costs and delaying needed nursing care. The team analyzed records for more than 600,000 Medicare patients in 2023. Finding when the 3-day rule was reinstated after the pandemic waiver expired, hospitals began stretching stays without clinical reason just to meet threshold for nursing home coverage. In fact, hospitalizations of 3 days or more increased by 1.1 percentage points and 5.6 percentage points for patients who eventually went to SNFs, adding up to more than 2,000 extra hospital days in the first month, with no improvements in patient outcomes, mortality, rehospitalization, or SNF length of stay. Researchers say it's because today's hospital stays are already much shorter than they were 60 years ago, making a rigid 3-day cutoff outdated and inefficient. At the ECAP Summit, AHCA President and CEO Porter blasted the rule, criticizing Medicare for clinging to regs written long before modern care practices existed. The study's fueling renewed debate among policymakers, many of whom have tried, unsuccessfully, to repeal the 3-day rule for years. Findings suggest the policy may now be inflating costs, slowing care transitions, and adding strain across the entire healthcare system. A new proposal to reshape nursing home staffing, the Nurses Belong in Nursing Homes Act, would resurrect staffing mandates similar to those introduced and repealed by CMS. The bill sets minimum staffing standards, including a 24/7 RN on-site and at least 3.48 nursing hours per resident day across RNs, LPNs, and CNAs. It also includes a major enforcement boost, calling for $800 million annually beginning in 2027 to strengthen inspections and oversight. Another provision would require CMS to use CMP funds to invest directly into the LTC workforce through education, training, loan forgiveness, and career pathway programs. Supporters argue the law would close dangerous staffing gaps and make nursing homes safer. Lawmakers have condemned eliminating the rule, saying it leaves residents at greater risk of abuse and neglect. The bill faces steep political odds, but industry leaders are also raising alarms. AHCA President and CEO criticized the proposal as outdated, saying it ignores the nation's severe caregiver shortage and risks forcing facilities to close and cap admits. Leading Age echoed the concerns, warning mandates don't address fundamental issues: shrinking workforce, restrictive integration policies, and massive funding shortfalls as states brace for federal Medicaid cuts, noting providers already face a shortage of 3,000 RNs nationwide and estimate a 24/7 RN rule would alone cost nearly $350 million annually. The bill also adds a new requirement for review. The Department of Health and Human Services would study staffing adequacy every 2 years, bringing residents, families, workers, unions, and operators into the evaluation process. If passed, staffing requirements would go into effect within 180 days. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, Sign up for the newsletter and remember, for all of your QI needs, call the Q.